As we continue our 2-month Taking Action for Your Health campaign, we kick off a week focused on skin cancer with our specialists at Florida Cancer Specialists. It's something we all try and protect ourselves from, especially living in the Sunshine State. Well, today we're going to take a look at melanoma. While it's typically associated with the skin, it can affect other organs quickly.
Today, Mrs. Orphan, we're going to do a skin biopsy on a suspicious lesion on your chest wall.
Helen Orphan, a breast cancer and stroke survivor, has been coming here to Florida Cancer Specialists for years.
She came for her annual visit, and Dr. Drapkin noticed this mole. When she showers, I just didn't think anything of it. We didn't even notice it.
The area in question is irregular and pigmented, and Dr. Drapkin says there's a chance it might be skin cancer, maybe even melanoma.
Melanoma is a cancer, a malignancy of the cells in the body that produce pigment. These are called melanocytes. They can occur anywhere in the body, but predominantly they occur in the skin.
Melanoma is completely curable if found early, but it can be deadly if it spreads.
If the tumor starts to grow and invade deeper into the tissues and eventually get into the blood supply, it can spread to every organ of the body, and at that time, it's invariably fatal.
This is a PET scan of one of the doctor's recent melanoma patients.
The brain takes up much of the glucose, but here we have irregular nodules consistent with brain metastasis. These dark spots along the spine are bone metastasis. We have a spot in the liver as well.
Dr. Drapkin says this man's disease is fatal, which is why early detection for patients like Helen is so important. The doctor is removing Helen's suspicious area and sending it to pathology to check for cancer. Dr. Drapkin wants to make sure that you know what you're looking for in terms of suspicious skin lesions. All you have to do is remember your ABCs. Be suspicious of anything that is asymmetrical or not round, has irregular borders. If it has certain colors in it, not just black. If it's bigger than 6 millimeters, which is about the size of a pencil eraser, or if it's changing or evolving. By the way, I'm happy to tell you that Helen's biopsy came back normal. Good news for her and her husband. For more information about Florida Cancer Specialists, head over to my Facebook page. Just look for Linda Hurtado, WFTS, under Pages, and click like.